Well, today we're continuing our visit with Gulfport Behavioral System on Highway 49 in Gulfport, finding out all the wonderful services that they do have. And we're talking now to Cynthia Render-Leach, who is the Human Resources Director.
Yes, thank you.
How are you?
Very good. Good to have you back.
Thank you. It's good to be back.
I know.
Give us a little bit of background about yourself and exactly what you do here at Gulfport Behavioral.
Sure. I've been in Human Resources for over 30 plus years, primarily in healthcare. So I came to UHS in 2018. And I'm part of the responsibility to help recruit wonderful staff to take care of our patients.
Now, you have so many wonderful, as you mentioned, staff members.
Yes.
We've met some of them in the past.
Yes.
Well, we're going to talk to some more of them today. And you take a lot of pride in hiring the right ones.
Exactly. You know, the people that we look for, people that have that empathetic spirit, you know, they're the ones that are attracted, who want to help this patient population. We're very fortunate to have wonderful clinical staff, physicians, nurse practitioners, nursing team, program therapists, recreation therapists, you name it. But everybody feels responsible for the care of the patients while they're here. And we want to embody that. We want to make sure they understand no matter what role they play, they're vital to the success of our organization and the care of and treatment of our patients.
Well, we're going to talk to a few of them today here on the show,
Great.
so thank you so much for being here with us.
Absolutely. Thank you.
Now, Eddie Richards is the business military liaison here at Gulfport Behavioral. How are you?
Doing well, sir. How are you today?
I'm well, thank you. Tell us a little bit about yourself and your role here at Gulfport Behavioral.
Okay, I'm actually retired military. Put a little 29 years with the military.
Thank you for your service.
Position opened up here for me to become the military liaison. And what I do is I go around to different military installations and tell people about what kind of unit we have here. We actually have a thing called Eagles View. It's a 18-bed wing, strictly for military. It's active duty, guard, and reserve. And we are putting our veterans on that wing also.
Oh, that's awesome. Now, your role as far as working with them once you get them in here, you have different groups that you work with.
Well, we have different things we have set up, but everything is set up just like the military. They have basically a schedule they go by, which they do the pet therapy with Doc, yoga therapy, and the different therapies. But the big thing is they're kept together as a military unit. In other words, they're not put in with the other groups. They're kept together. A lot of times, just them being together in their groups, they open up a lot more because they've been there, done that with these same people, and they can relate to each other. So our therapist works with them as a group and one-on-one. Have a lot of extra opportunities for them to share and things like that.
You have something else you want to tell us about?
Yes, sir. Congress passed an act, it's called Compact Act, and where veterans who have been discharged, if they're having any signs or things about maybe hurting themselves, it provides them 30 days of paid care, inpatient care, and 90 days of outpatient care at no cost to them. And if they're not enrolled in VA, we get them enrolled in VA. And we also have some groups from the outside come in and help them work claims so they can get VA benefits. And we're using our local partners with the VFWs, American Legions, and people like that to get involved in helping them. Also helping them get housing if they need housing, and jobs if they need jobs. So we don't work with them just while they're here. We care about them once they leave to put them back in society, to be productive in society.
That's awesome. That's awesome. Thank you so much. Appreciate
Thanks,
you. Now, Danae Piquel is in charge of admissions and intake. How are you? Pleasure to meet you.
Good, how are you?
Tell us a little bit about the job that you do here at Gulfport Behavioral.
Okay, so in admissions, we offer assessments 24 hours a day, 7 days a week, even on holidays. We assess for level of care, whether that be inpatient or outpatient treatment. We try to find placement for patients, whether that's at our facility for our inpatient treatment, or if it is in an outpatient setting like our IOP or PHP program. We do provide referrals to community mental health as well, but we do level of care assessments 24 hours a day.
And of course, if they want to, call in to make an appointment, something like that, there's an 800 number there that's at the bottom of your screen, but it's 800-831-1700.
Yes.
And and you can take care of them.
Yes, of course, we do. We provide appointments and walk-ins 24 hours a day.
All right.
Thank you.
Thank you so much.
Thank you.
Now, Michelle Wilson, talking about recreational therapy, correct?
Yes.
Tell us a little bit about what they do here.
Okay, our therapeutic recreational department, they strive to provide opportunities for patients to learn new coping strategies and enhance interest in previous activities that they may have kind of went by the wayside. The primary focus is increasing our patients' 5 dimensionals of health: physical, emotional, social, spiritual, and intellectual. We have inclusive programming, including creative expression, meditation, relaxation, physical exercise, yoga, and of course the famous pet therapy.
With Doc.
Yes, but we also do pickleball.
I love pickleball.
Yes.
That's great exercise.
It is. And then afterwards, the recreational therapists discuss their goals and how they can bring those activities and those coping skills into their regular life once they're discharged.
That's awesome. Michelle, thank you so much. We're going to talk to the CEO now here at Gulfport Behavioral. Dean Doty is the CEO here at Gulfport Behavioral. How are you, sir? It's a pleasure meeting you.
Thank you, Jim. Appreciate it.
Tell us a little bit about your role here and how you deal with patients and everything.
Okay. As CEO, I'm responsible for our hospital for inpatient and outpatient services. We offer inpatient services for children, adolescents, and adults, starting at age 4 and up to, in their 70s or sometimes their 80s. And we treat folks that have mental health issues such as depression, bipolar disorder, schizophrenia, and we have recently begun treating folks with substance use disorders as well.
Oh, wow.
Yes.
That's awesome.
Thank you.
The different programs that they have here. We've been coming out here for the last few years, and every time we come out here, we find out more wonderful things that they're doing here at Gulfport Behavioral.
Thank you. We about 1 in 3 or 1 in 4 people will experience a mental health or substance abuse crisis in their lifetime, and so it's safe to say that every American will have an impact in the disorders, meaning someone in your family or a friend will be affected by mental health or substance use disorders, and it not only leads to lost productivity, but it also leads to an impact in their roles of functioning, whether they're a mother, a father, a parent, a brother, a sister, or just a friend.
And each one is you deal with on an individual basis too, because each one is going to definitely be different.
Correct. And so each person will have an assessment, and there's no cost. It's 24 hours a day, 7 days a week, to determine do they have a mental health issue that needs some level of care for treatment, and then we will help them determine what is best for them.
All right. Dean Doty, thank you so much.
CEO
here at Gulfport Behavioral. If you need some help, you've got a family member that needs some help, what you need to do is call the number on your screen, set up an appointment with them, as we've heard that they are available here for you 24 hours a day, 7 days a week. And get some help that you may need here from Gulfport Behavioral System. They're located on Highway 49 in Gulfport, north of I-10.